Recently, Oregon Governor Kate Brown's office eased restrictions on dental offices in the state, allowing them to reopen. But even though those restrictions were lifted, we know there are still many challenges dental offices are facing as they work to bring things back online. Joining us live this morning to talk more about what we're seeing now is Terry Barrichello, the Vice President and Chief Dental Officer at Moda, a health insurance company. Thank you so much for joining us, Doctor.
Thank you. It's nice to be here.
Yeah, so what are some of the challenges you're hearing from dental offices as they are working to reopen in Oregon?
Well, first, I just want to recognize the governor and thank her for recognizing the importance that oral health plays in the entire health system and in helping to get dentists back and dental offices back to operations. But that, of course, doesn't mean that things return to total normal pace. There are some new rules that dental offices have to adhere to that will make that return much more gradual and slow.
Yeah, well, I know we heard from dental offices in the weeks leading up to this reopening. They were worried about having enough PPE, enough protective equipment for their staff. They were working to kind of change some of the procedures because they are very up close and personal with their patients' mouths, and there are health risks there. So what are some of the changes we've actually seen at dental offices as they work to keep people safe?
Sure. Well, every office is going to be a little bit different depending on their patient population, their staff, and their physical location. But some of the changes that, as a patient, you might experience, your office may want to pre-screen you before you come in order to prioritize your care. They've been obviously not working at full capacity, so they do have a bit of a backlog that they need to make sure that the most urgent procedures get taken care of. When you come in, you may have your temperature taken, and you may even need to do an antimicrobial rinse. Your providers will be wearing a different type of personal protective equipment, and as you mentioned, there is a bit of a shortage of that, so that can also kind of slow the pace of return to full operations for dental offices.
Yeah, you mentioned a bit of a backlog there as they work through some of these patients that want to get in and see their dentist. What kinds of appointments can services or clinics providing right now? What are they focusing on first?
Well, under the order, any service is allowed, but certainly because of that backlog, the types of procedures that I think dentists are going to want to prioritize. Certainly, pain and infection cannot wait, but also any treatment plans that had been diagnosed, we're going to want to get right back to getting that in the right sequence. A delay of care for even ordinary procedures like fillings, etc., can result in much bigger fillings and even, say, the need for a root canal or extraction. So we don't want those things to wait. I think it's important too that we all realize the importance that prevention plays in all of this, and we don't want to have a lapse on the preventive procedures, especially for kids.
Yeah, if we're looking at those preventive procedures, if people know they're overdue for that dental checkup, how do you suggest people go about it? Should we just wait things out right now or go ahead and try to set up an appointment for sometime in the future?
I recommend you call your dental provider. They're going to guide you through what is right for your particular situation, as well as for the pace at which they're returning at their office. And if you don't have a dental provider, certainly if you have dental insurance, you can go to the websites like our own Delta Dental and search for a provider. We even have an opportunity for a teledental visit via a portal where you can upload photos and we'll connect you with an in-network provider.
Oh, wow. I've heard of telehealth, but I didn't realize that was an option for dental visits.
Yeah, it's becoming the norm in these days as we need to screen and prioritize treatment.
Yeah, absolutely. Well, doctor, thank you so much for joining us this morning. We appreciate all the advice, and we'll have more information and resources on booking those dental appointments on KOIN.com. Thank you, and stay healthy.